Hi, my name is Gertrude Orakwue. I'm a nurse practitioner with Active Aging Services. I have a background in microbiology and a master's in nursing and a doctorate in nursing. And I've been working with Active Aging Services for the past 2 years. Yeah, I do work as a primary care provider for patients in the nursing homes, and I do palliative care visits in assisted living homes and in the clinic, and I do provide memory consult for patients that have concerns with memory issues. We do diagnosing them for Alzheimer's, dementia, and other types of dementia treatment. I look at prognosis and I share things, what family and patient has to expect at each stage of their dementia. And I do work with them and social services to provide resources that are available in the community that they can access, like help them with placements. Like some of them might need to have more cares provided for them, like if they need assisted living facilities or people already living at assisted living, if they need skilled nursing, we do provide. I do counsel and advise on those areas too. Yeah, I do medical cannabis program in the clinic, and I look at qualifying conditions. We get referrals from providers in the organization and outside the organization, and some patients they do self-referral. When they come in, we have this some of our workers in the Active Aging Services screen them and see if they're appropriate for medical cannabis, and then I review. And when I review, I look at their diagnosis, are they qualified? I review their mental health, because I've seen that most of the people that come in with chronic pain also have some mental health issues. I talk, if they're seeing a psychologist or psychiatry, I do like to discuss and see if those patients are appropriate for medical cannabis. I also look at contraindications. That's something medications or conditions that are contraindicated to medical cannabis. These are what I review before I then see patients and certify them for a year and then recertify every 1 year. Just like for the general population, the same thing for older adults. I know that some people have been living with chronic pain, most older adults, and they're kind of taking opioids, and at that stage they want to withdraw from opioids and stay on something that can improve their pain. So these are medical cannabis have helped with chronic pain, and it also qualifies for Alzheimer's dementia. Though I haven't had a lot of patients coming for Alzheimer's dementia, but it's something that qualifies them to take medical cannabis. And I know medical cannabis doesn't just help older adults with pain, even though anxiety and mood is not a qualifying condition, but I've seen in my practice that it helps them a lot with their mental health. It helps them with sleep. It helps them even with increase in appetite and improve their quality of life. A lot. It's like bringing care to their home. They don't have to go outside their home to get the care they need. So it's been helpful meeting them at their place of need. I do go to assisted living, and we are not doing home care now for palliative care, but we do assisted living. But there have been some times that we have to go to the home. Like recently, we had a patient that was supposed to see me in the clinic for palliative care, and she rescheduled the first time. The second time, the daughter called and rescheduled, and I talked it through with my nurse, and we decided to go and see her in the home. And we went in, and she was declining. We felt she needed hospice. So at that point, we offered hospice and gave her the resources she needed. And we felt so good at the end, because she died almost 3 weeks after we saw her. And that was providing care. At that moment in time, we were able to give her comfort that she didn't have. Coming in to have other palliative care team, the hospice team, doctors and us coming at that point in her life, gave her extra relief at the end of life. So these are the things we do. It helps a lot with family members, and then the family were able to prepare themselves for her death, because when we saw her, we were able to tell them this is. Even one of my nurses said, I gave her 2 weeks, and it was like so the family were prepared and the patient was prepared for those end of life care. So it's very good to go out to where they need the help, the care, and that's what OMC is doing. We are trying to see if we can go home palliative care visit. That's in our goal, to meet them at their point of need. That's such a delight. I never considered a career with older adults till I moved to the United States, and I was trying to figure out what to do with my life. And I started working with them as a CNA in the nursing home, and I loved the patient. I loved the interaction. I felt there is this connection I have with older adults. It's like taking care of your grandparents. So I decided to go into nursing and got my master's and my doctorate, and now practicing as a CNA, as a NP, and it's so rewarding and satisfying. They come back, the smile, the differences I see in the care I give, the taking care of their chronic issues and their acute issues, and just the joy and the delight they give. That's what draws me in, and that's what keeps me working in as a nurse practitioner in this field. I do love what I do.